Friends and to all my colleagues and to all my fans and students everywhere. This is Professor Dr. Tarek Ali. Today I will speak about an important topic in the healthcare profession in general and in clinical medicine in particular, and this is related to what we call the clinical practice pitfalls and the problems of healthcare in the current era. To start with, I have spoken before about basic facts in clinical medicine logic, or what we call the clinical logic, يعني المنطق الإكلينيكي. And I have highlighted the importance of understanding what is called the clinical logic as one of the most important thinking skills in clinical medicine, اللي هو المنطق الإكلينيكي. وكيف يستخدم الكلينيشن المنطق الإكلينيكي in order to reach to the proper clinical decision and in clinical decision making and for proper patient management or proper clinical management of the healthcare consumer who is the patient, and in order to raise the efficacy of the healthcare and to minimize avoid patient harm or patient harms or putting the patient at risk. That is to decrease the morbidity and mortality in the clinical practice. That's why the clinician should understand and should pay attention to what's called the clinical logic. And I have mentioned that the basic facts in clinical logic or in clinical practice logic, اللي هي القواعد الأساسية في الطب الإكلينيكي, is that the healthcare provider or the clinician in general should understand the following. Number one, in clinical practice or in the healthcare profession, I have mentioned before also that there is a difference between medicine as a science. That's what's called to be more broad-minded, the medicine as a knowledge, because we all know that there's a difference between the word, by definition, between science and knowledge. Knowledge is wider in definition than science, because science is a discipline in knowledge, but knowledge contains many disciplines, including philosophy, including the discipline itself, that is a nizam, our system, our other disciplines in the knowledge in general. That's why the word medical knowledge is wider than the word medical sciences or science. As I mentioned, in the number one fact in medicine as a science, and especially that I also have mentioned the fact that there is a difference between medicine as a science and medicine as a medical profession, on the other hand, as an industry. As an industry. There is a difference between, again, medicine as science or sciences, which are acquired through medical education in the medical schools, including both the basic medical sciences and the clinical medical sciences. This is medical knowledge or medical science in general, but medicine is not just a science. Medicine is a science and an art. And as I mentioned before, it's a science of uncertainty and an art of probability. The art of medicine is not acquired through medical education. The art of medicine, actually, it belongs more to the medical profession, to the medical practice, to the clinical performance by the healthcare provider. So this is very important to remember, that there's a difference between medicine, again, as a knowledge or as a group of sciences which are learned in the medical school or in the faculty of medicine or in the medical university, and between the medical profession. Medical profession is an industry. It is a performance. It is practice. So we should close or fill the gap between medicine as a knowledge or as group of sciences and medicine as a medical profession, as medical practice. In the medical profession, the art of medicine plays a major role. in conjunction with or in combination with the medical sciences which are studied in the Faculty of Medicine. Because the medical practice, because the art of medical profession or the art of medicine, which is the medical practice, is derived from three important sources. Experience, which are gained through consistent and persistent medical practice by the clinician, number one, and number two, by understanding the wisdom of practice or the philosophy of medicine, and number three, by common sense in clinical practice. So the medical practice or the medical experience, the wisdom, and the common sense are the main components of the art of practice. The art of practice, that is the art of the medical profession. Or, to be more a broad spectrum, or to be narrow spectrum, the art of medicine. But as I mentioned, medicine is basically science or knowledge, which is learned in the Faculty of Medicine, because the art of medicine is not acquired through medical education in the medical school. We don't give lessons about the art of practice. Maybe just to give an idea that there is, as a university staff to the medical students, that there is art of practice. But this is seldom done. Most of the staff in the medical schools focus on the science of medicine itself rather than the art. The art of practice is very important, and this forms half of the medical or clinical practice, because it shows how does the clinician or how does the medical practitioner or the healthcare professional understand the knowledge so as to implement it into clinical practice, because the physician or the clinician doesn't reach wisdom of practice unless he or she implements the medical knowledge in its proper way and in its proper form and in its real, deeply understood way, so that we transform the knowledge to wisdom. Because the wisdom is more deeper than the science itself. You may know the science, but this doesn't mean that you understand the science, whatever it is, basic or clinical science. To understand is more deeper than just to know. And here comes the distinction between a good clinician and a poor clinician or a bad clinician in understanding, which gives him the best, or gives him or her the best performance and the best practice and the best and will show the art of practice of the clinician. Or how does the clinician have an art in clinical practice or in the medical profession or in his healthcare job or a profession or as a provider. So this is very important to understand this basic fact. Number one, there's a difference between medicine as a knowledge and the medical profession. And we have to fill the gap between the medicine, which is taught in the faculty, which is learned by the student in the Faculty of Medicine or in the medical school, and between the medical profession, that is the profession as practiced in the clinic or in clinical practice, as I mentioned. So this is number one. Number two, that we have to understand in the clinical logic, في المنطق الإكلينيكي, القواعد الأساسية in that. Don't forget that we are treating a human being, not just a human body. This is number one very important fact. We are treating a human being, not just a human body. And human being, by definition, is wider in terminology as a definition of the term than the body, because human being involves three components, as I mentioned before: the soul or the spirits, the soul, ruh, and the body and the mind. And as I mentioned, that the human being is basically a soul. You are a soul. You have a body. You are not a body. You are a soul, which is put in a configuration or image. We call it the human body. And this soul is the main master of the issue, is the main master of the being, is the main master of the human being, the soul inside the body. And this soul is what we call the spiritual part of the human constitution, or the spiritual part of the human being. And the mind, as the third component, in addition to the body and the soul, drifts in between. That's why we say that there is a soul, there is a body, and the mind drifts in between. The soul is born old and grows young, while the body is born young and grows old, as Plato said. And the mind drifts in between. And the mind is, as I mentioned before in my lecture about the brain-mind unity, that the mind is the non-touchable or the non-physical part of the brain, and it carries many important secrets. And this mind controls the human body. So the soul controls the mind and the body. So when we are treating a patient, or when we are treating a human, we have to understand that we are treating soul, mind, and the body, and not just a body, because the body is affected by the mind, and both of them, the body and mind, are triggered or moved by the soul, الروح. ويسألونك عن الروح قل الروح من أمر ربي وما أوتيتم من العلم إلا قليلا. So focus on the soul, the mind, and not just the body. This is very important to be remembered by any clinician. We are treating the soul, the mind, and the body. The soul, that's why in the Asian medicine, for example, في الطب الآسيوي في Japan, في China, في many of the Far East countries, they are focusing on what we call in the Chinese medicine, for example, they focus on managing the soul in the spiritual, this is what we call spiritual aspects of medical treatment in the Chinese medicine, for example. Spiritual aspects. You should also focus in many conditions on treating the soul. Because if the soul is disordered, or if the soul is not at rest, or if the soul is not feeling peaceful, this will affect the mind and the body, and this human being will be disordered or affected. That's why there is what we call spiritual techniques in Chinese medicine, for example, and this is through using, in general, my lecture is not today about how we treat the soul in particular, but I'm giving you just an idea to open your mind, to remind you as a reminder to clinicians, and so that the clinicians will not only focus on just the body. No, the body is the moved. The body is just a machine. It's formed of group of machines. The ear is a machine. The eye is a machine. The organs of the body are just machines which move this body. But this body is moved by what? This is the secret. This body is moved, or what moves these machines? All these machines, the soul. The soul, الروح. That's why here comes the spiritual aspect. يعني الجانب الروحي للمخلوق الآدمي. وده الأساس. This is the basic. To focus on the soul. Because if the soul, as I mentioned, is having a problem, or is disrupted, or is not feeling peaceful, it will affect the mind and the body. So there is, for example, methods of treatment of the spiritual aspects of human disorder by the yoga, باليوغا, بالmeditation, والتأمل, وبعض التكنيكس. These are the two main methods of treating the soul, yoga and meditation. And there are several techniques in the yoga and several benefits of the yoga for spiritual improvement and for improving the mental performance and the physical performance of the human being, and also the techniques and methods of meditation in improving the physical and mental performance, and managing the mind and consequently the body. So many disorders can be treated by paying attention to the mind, to the soul. And then comes number two, after the soul also we have to remember that many of the physical problems arise in the mind. And this is represented in clinical medicine by a very important group of disorders. We call it the somatoform disorders, or the somatization disorders in psychiatry, or the psychosomatic disorders. in the previous classification, but we can still use this term in clinical practice in the current era, the psychosomatic disorders or somatoform disorders, that is physical disorders or physical conditions which arise in the mind, that is start in the mind, and the primary problem is in the mind, like the physical problems arising from anxiety, from depression, from stress, as the primary mental or psychic problems, which consequently cause physical problems in the gastrointestinal tract, in the heart, in the lung, in the head. So, as represented by these three common psychic disorders or mental problems, the anxiety, depression, and stress. And we all know that stress is the most common disorder affecting the globe, that is the worldwide. يعني أكتر مشكلة صحية بيعاني منها البشر في العالم هي مشكلة التوتر، الستريس، سواء كان acute stress أو chronic stress, which is the, in my opinion, the most important drastic healthcare problem in the affecting the people worldwide. Stress. لأن الستريس هو اللي بيؤدي إلى كثير من المظاهر الفيزيكال اللي احنا بنشوفها في الكلينيكال براكتس، سواء كان هو التريجرنج ايجنت او بيكزاسربيت underlying physical problems زي الديابيتس، زي الهايبرتنشن، زي البرونكيال اسما، زي ايفن الكانسر، في علاقه بين الستريس والباثوجينيسيس of some types of cancers or malignant neoplastic processes in the human body. فهنا managing anxiety, depression and stress in order to relieve what we call the psychosomatic disorders. So the mind is very important, being in many cases, I will not say sometimes, no, it is in many cases, 50% of patients presenting in clinical practice in the clinic are suffering from psychosomatic disorders. In many of the statistical publishments or works in many medical authorities and by the WHO, that the psychosomatic disorders in fact represent many, I will not say all, but many of the cases in clinical practice, they have problems starting in the mind, and this is the somatoform disorders or the psychosomatic disorders. And if we manage the primary psychic or psychological problem, the physical symptoms will disappear. Because as mentioned before, not all the symptoms are always pathology. I mentioned before that the symptoms and diseases might be either psychological, physiological, pharmacological or pathological. يعني الأعراض والأمراض اللي بتصيب الإنسان هي واحد من أربع حاجات، يا إما psychological، يا إما physiological، يا إما pharmacological, that is due to drugs used for one disorder causing another problem, drug-induced medical problems. And number 4, pathology، يعني disease. فمش كل المشاكل اللي بيعاني منها البشر, not all the human problems is representing or means a disease. Or in other words, not every symptom is a disease. مش كل دايما عرض يبقى مرض. فهنا this is very important to understand. So here comes the mind. So this is very important to understand that we are managing a human being, not just a human body. A human being means soul, and here the spiritual techniques in management of human disease, like the yoga and meditation and the Zen techniques, most common and very important technique in meditation, Zen. And this is well known in Chinese medicine, Asian medicine, for example. And number 2, the mental aspects of patient management, that is treating any underlying psychological disorder, because if you focus on the body and treat the symptom, and the problem is in the mind, and you didn't focus on the mind and how you treat the mind by psychotherapy, by psychological, by behavioral modification, by all the psychological techniques, and or in addition to also psychotropic medicines, that is medicines which treat anxiety or depression or relieve stress, the physical symptoms will not improve. You have to focus on this in psychosomatic disorders, that is problems arising in the mind, when the primary problem is in the mind. Because I mentioned before, we have to know where is the primary problem and where is the secondary problem. The primary we have to target it. For example, in psychosomatic, the primary is in the mind. There is mental dysfunction causing physical problem. That is either symptoms or, if neglected over the long time, it will become a disease. For example, gastritis or peptic ulcer complicating chronic stress, or cancer if the stress is long-term and it might also cause this or help in the pathogenesis of the neoplastic process. It also might trigger many autoimmune diseases, the stress and autoimmune disease. So we have to manage the mental problem in its acute phase before becoming chronic and causing chronic disease, or is transformed into a chronic disease. So this is the mind as a part of the human being. So هرجع للكلام تاني. I will come back or go back to the first point, which is that we are treating a human being, soul, mind, and body, not just a human body. Number two fact, when we are coming to the issue of the body, we are treating a body, not an organ or system. This is the second fact in the clinical logic or basic facts in clinical medicine. We are treating a body, a group of organs, a group of systems, not just a liver, if the primary problem in the liver, or in the heart, or in the kidney, or in the brain, or in the gastrointestinal tract, or in the bone marrow, or no, we are treating a complete human body. So when you should understand that you are treating a body when you are approaching the patient for diagnosis, and number two, then for treatment. Because if there is no diagnosis and there is no proper diagnosis, there will be no proper treatment. So you have to diagnose well before deciding treatment or your treatment plan or your therapeutic plan or your therapeutic approach. If the diagnosis wrong, all the treatment is failure. So focus on the body, not just an organ. Yes, you have to understand that the primary problem, for example, is in the liver. But when you are diagnosing, you have to understand how did the liver affect the other organs of the body. And also when you tailor or you design your treatment, you have to select the proper therapeutic approach for which suits not only the liver, which suits the whole body. Maybe you will treat the liver, but you will cause problems in other organs by your treatment if you are not using your or choosing your drug in a wise, sound, rational, logical way. So you have to understand that you are treating a body, you are managing a body in diagnosis and in treatment, not just an organ or system. Number three, as a basic fact, that we are treating a disease, not just symptoms. And I have mentioned this in many of my lectures, that the clinician should understand we are not treating symptoms. You should not be symptom oriented. You should be pathophysiology or pathobiology oriented for management of the patient and for selecting a treatment. That is what, and I have mentioned this in my previous lecture about the pathobiology based or pathophysiology based therapeutic approach or drug treatment or medical treatment. Number two, symptom-based medical. If we didn't understand if we didn't know the exact cause and we didn't understand the pathobiology, and we couldn't attack the pathobiology of the disease, and we couldn't target the mechanism of the disease, or what we call the pathobiological mechanism or the pathophysiological mechanism of the disease, because we don't know it or we don't understand it and we can't reach to it. So if we fail to do this, we have just to manage the symptoms, at least, in order to get what we call the functional outcome, the best functional outcome of the patient, and to relieve at least his symptoms. The pain, bleeding, the most common, of course, clinical symptom is pain, for example. So manage the pain at least. If you don't know the source of pain, the cause of pain, the disease which caused this, the pathobiology of this. We are not treating, for example, hyperglycemia. We should understand the mechanism and the pathobiology of diabetes. Hyperglycemia is just a denominator, just a marker. We should not just treatment the hypertension. Hypertension is a symptom, not or a sign, not a disease by itself. We have to understand the basic pathobiology of hypertension, whether primary or secondary hypertension. Is it primary or secondary? And if it is secondary, is it renal hypertension, endocrine hypertension, hematological, cardiovascular, all the causes of secondary hypertension? And if it is primary, is it volume-based or it is activation of the renin aldosterone system or the RAS, or is it related to sympathetic overload, sympathetic overactivity, the three basic mechanisms of primary hypertension, so that we can select the proper drug. So we have to understand the pathobiology, not just given the drug blindly. Which drug you will select? When you are treating edema, don't just give diuretics. No, you have to understand what is the cause and what is the disease and what is the pathobiology of this edema and the disease causing the edema in order to manage the pathobiology and to know how to and to understand which type of diuretic you are giving. Is diuretic is the proper line of treatment, or you have to choose other therapeutic plan or other drugs or other management, non-pharmacologic therapy, or many ways to approach a patient, for example, with edema or same. I have mentioned different symptoms and signs. We have to understand the pathobiology and the underlying etiopathogenesis, not the symptoms and signs. Symptoms and signs دي المظهر الخارجي للمرض. أما عمق المرض هو ده لازم إن أنت تأتاك it in clinical practice. You should target the depth of the disease, not the superficial aspects اللي هي الجوانب السطحية للمرض. الجوانب السطحية للمرض هي دي symptoms و signs. But the good clinician or the good practitioner in the medical profession and the healthcare is to understand to get the etiology and the etiopathogenesis and to understand the pathobiological mechanism of the disease and target this. When you target this, the symptoms and signs will be treated. But if you just target the symptoms and signs without targeting the depth, the disease will recur and the disease will never be cured. So this is very important, and this is one of the important causes of failure in clinical practice, of failure of management, اللي هو فشل إدارة المريض وفشل العلاج. لأن التشخيص فيه problems in the diagnosis and consequently there are problems in treatment. So the good clinician should understand this, that we are not treating symptoms, we are treating a disease. We are not treating organ or system, we are treating a body. We are not just treating a body, we are treating a human being. That is soul, mind, and body. These are basic facts in clinical medicine, which clinicians should pay attention to it. And this is the basic of, or the roots of my lecture about the superficiality in clinical practice, اللي هو السطحية في الأداء الكلينيكي, or superficiality in clinical performance. وأنا بدأت بالroots أو الجذور أو المصادر sources ليه في superficiality in clinical practice, because they don't pay attention لل basic facts in clinical logical, which I just mentioned right now, since the beginning of my presentation now. Consequently, because there is poor understanding or misunderstanding or no understanding of these basic facts in clinical logic or in clinical medicine logic في المنطق الإكلينيكي, مفيش فهم صحيح ليها, وبالتالي في سطحية في الأداء الإكلينيكي, or there is what we call superficiality in English in clinical performance. And there are many mistakes in the clinical management, وكذلك بالتبعية في أخطاء في الإدارة الطبية للمريض. There is mistakes in diagnosis, وبالتالي بما أن في mistakes in diagnosis, there will be mistakes in treatment, or the diagnosis may be right or partially correct أو شبه صحيح, but the therapeutic plan is not correct, is not the best plan, is not the best approach for proper management and consequently for cure of your patient. So you have to start by the diagnostic process and then the therapeutic process. If the diagnostic process has pitfalls, the therapeutic plan will be at risk of being incorrect. The therapeutic plan will have problem. There is disorder in the therapeutic plan. There are faults in the therapeutic plan. There are pitfalls in the therapeutic plan. So start with proper diagnosis. And to start with proper diagnosis, you have to understand the pathobiology of the biological basis of your disease in every individual patient. في كل مريض على حدة. لأن مش كل المرضى حتى لو even if they are suffering from the same disease, they have the same pathobiology. No. For example, if you bring مثلا diabetic population, مش كل مريض diabetes زي التاني، هم كلهم ظاهرا عندهم diabetes for example أو have been diagnosed as being diabetic. But the pathobiology is not the same. So you have to understand, in order to apply, to understand the exact pathobiology and the exact etiopathogenesis and mechanism in your individual case, in order to plan the best and to tailor the best therapeutic plan and the best therapeutic approach to every case separately. And this is what we call precision medicine, our concept of precision medicine, our personalized medicine, our individualized medicine. ان انت كل حالة بتحددها ايه بالظبط المشكلة فيها، بصرف النظر عن ان هي كله جاي بهايبرجلايسيميا. No, the problem is not just hyperglycemia, the roots of hyperglycemia, the roots of the disordered carbohydrate metabolism and protein metabolism and lipid metabolism. لان احنا عارفين في الديابيتك بيشنت كل المين سبستريت ميتابوليزم بداية بالكربوهيدرات اللي هو بيؤدي في الى هايبرجلايسيميا، وبعدين كذلك سكندري في البروتين ميتابوليزم وفي الليبيد ميتابوليزم، في ديسليبيديميا، في هايبر كاتابوليك ستيت، في بروتين كاتابوليزم، في كل السبستريت ميتابوليزم بتتلخبط في الديابيتك. فلازم نعرف الميكانيزم اوف disruption of the these biochemical abnormalities in diabetes in order to understand the whole cardiovascular metabolic status of every individual case suffering from diabetes. And here this is very important. I'm giving just diabetes as to exemplify to you that you should understand the pathobiology. نفس الكلام في hypertension. I just said in hypertension you have to understand what is the cause of the high blood pressure is not a disease by itself. It is just a manifestation. سواء هنسميها symptom أو sign أو الاثنين، هي manifestation that the patient had some problem with his blood pressure, systemic pressure. كذلك لما بقى أشوف حالة portal hypertension لازم أعرف إيه سبب البورتال hypertension، ده بقى موضوع كبير. Is it hepatic? Is it pre-hepatic? Is it post-hepatic? When it is hepatic, is it pre-sinusoidal ولا sinusoidal ولا post-sinusoidal portal hypertension? في البلمونري, is it primary or secondary? Is it genetic or due to other causes? What is the underlying mechanism of pulmonary hypertension? What's the pathobiology of pulmonary hypertension or in your individual case? So you have to understand this. فهنا understanding the pathobiology is very important. We are treating pathobiology disease, not just symptoms or signs. دي فاكت مهمة جدا زي الفاكت اللي أنا قلتها we are treating body مش مجرد organ، والفاكت اللي أولانية خالص اللي أنا we are treating human being روح وعقل وجسد مش مجرد جسم فقط مكون من مجموعة organs وsystems. هكمل كلامي على ما يختص بالبيتفولز في الكلينيكال بيرفورمانس او السوبرفيشياليتي الناتجه عن عدم فهم او اللي مصدرها هو عدم فهم البيزك فاكتس ان كلينيكال لوجيك او المنطق الاكلينيكي زي ما بسميه او الكلينيكال براكتس لوجيك. لازم الطبيب يكون عنده او الكلينيشن سواء كان طبيب او جراح او اي هيلث كير بروفايدر بيعالج المريض لازم يكون فاهم ان في لوجيك في الكلينيكال براكتس عشان يوصل للبروبر diagnosis and to reach to the and to tailor the proper therapeutic approach to his or her patient in clinical practice. Let me talk and continue talking about superficiality in clinical performance and mistakes in patient management in clinical practice and the problems of the healthcare system in my next lecture, inshallah, as a continuation. But this lecture is an introduction to the next lecture because it is basic to understand what I mentioned today in order to understand my next lecture or presentation, inshallah. Thank you so much, Professor Dr. Tarek Ali. My best regards to all of you.